when a couple is seeking, the approach that you provide for conception and you're identifying, you're getting the evaluation, what are your conversations with the male counterpart?
Yeah. So this is one of the most challenging pieces because males don't have a cycle that they can track. They oftentimes can feel completely normal, but they can still have problems with their sperm counts or their overall health. And the other that we identify is, and this is not a generalization across the board, but many times men are much more resistant to seeing a doctor and making some of those changes unless we can identify, hey, there's something specifically that's going on. So every once in a while, I get a guy that comes in and says, I feel like garbage and something is going on. But most of the time, we find that if there is a male factor that we identify, he might feel completely fine. And I think that's one of the most challenging pieces is that you can have sperm counts that are normal or high or low, and you might feel the exact same. The other that's tricky is that we look at more than just sperm count itself. We look at many other factors as far as the motility. So, how well do they move? What do they look like? All the way down to what's the actual DNA makeup? What's the quality of that sperm? And again, guys can feel completely normal and seem just fine and have no problems as far as sexual function, but they can have problems with the actual DNA quality of the sperm. So, it does take some detective work sometimes to figure out are there factors there that are playing a role? And then also to make those changes